test on what we've covered so far, which is the immune and immune process, basically, right? So the immune system, which we went over last week. We also went over immunizations, and we talked about their dosaging. Mainly as well, I think what you should focus on for the immunization is like the contraindications. Like, why should somebody not receive it, right? Or who should not, who should, things to know like that. The dosaging is not like a huge focus. The dosing will be a main focus in OB and peds, because kids receive it, right, like at 2, 4, 8, 12 months. And so they always ask the question, like, the child is X months old, you know, they say like they're late on their vaccinations or they're up to date. What do you expect will be administered next? So you should know what they just missed or what should be coming forward. So that's how they like to phrase that question. So I don't really focus too much on the doses as much as contraindications, reasons not to receive it. We talked about the immune system. We talked about like neutropenic precautions, right? Like what they should not do, like what happens if you are immunocompromised. Yes, from last week. Okay, we talked about neutropenic precautions, what not to eat, what not to do, how to take care of yourself, what to avoid. We went over definitions like neutropenia. We went over right thrombocytopenia, anemia, leukopenia, leukocytosis. So it's up to you to be up to date with this vocabulary and verbiage of the immune system. Okay. So for example, if we were to say, what is immune thrombocytopenic purpura, what lab values do you assume you're checking? Your platelets. Why? Thrombocyto, right? They're thrombocytes, and what does penic imply? Low. So their thrombocytes are low. Make sense? Then we also said words like pancytopenia. All three of them are low. White blood cells, platelets, and red blood cells. What else? Okay. So, to be up to date with your vocabulary is really important. A lot of times it's the difference of whether you get the question or not. When you're neutropenic precautions, we went over types of immunity, right? We went over like innate immunity. We went over then the 4 types of like acquired and active, acquired, right? So it's active and passive. And then they each had their artificial or natural and examples of how to get them. Yes. We went over systemic lupus, expected findings, right? Butterfly rash, joint pain, generalized fatigue. So make sure you know how they will feel and look. Labs for them, right? What are diagnostic procedures? What kind of actions they do, and I pointed out a lot of them for you. Protect them from the sun, white brim hat, long sleeve shirt, wear sunscreen. Right, like there's different things to do for SLE. It's more so the nursing actions and expected findings. Talk about T cells, B cells, their roles. There'll be cell-mediated immunity versus humoral immunity. Half of y'all look like thank God we didn't take that today. Probably for the best. That long weekend got to
Miami.
Yeah. What else? What else did we cover? Am I missing anything?
Shift to the left. Shift
Oh, what's a shift to the left? More than anything, what does a shift to the left imply? Like, what is? Oh, that's what's happening. What does that mean? Like, what causes why would you have a shift to the left? Acute infection. It means you have like a severe or very acute infection. Okay, and yes, it is a bunch of immature neutrophils, but that's why your immune system is flooding with even immature ones because you have an acute infection. Yeah, shift to the left, or a left shift, as they call it. No, that's cell-mediated immunity versus humoral. What else?
Stabs, bands.
The what?
The stabs and bands.
Stabs and bands. Well, that's the shift to the left. So stabs, right, are the segmented, mature neutrophils. Bands are immature. What else? Oh, so people that also like, a good one is what, like certain immunocompromised people obviously can be around 18, but then pregnant people, just because of how their immune system is, and the fact they're pregnant, also can't be around certain, if they can't receive the vaccine, they obviously shouldn't be around this disease as well. So which were these for the pregnants? So pregnants should not be around people who have MMR, which that's not a disorder, that's 3. Measles, mumps, and rubella. What else? Varicella, chickenpox. What else? Influenza, they should not receive the vaccine yet, as well, the live. And then there's one more.
Hindi pwede. No. Okay, perfect.
It's called fifth, like a fifth disease. The actual like name for it is erythema toxicusum. So make sure they're not around people with fifth disease. And as well as anybody with radiation. Yes.
So there's a question asking about the live vaccines from all grades or just MMR?
What do you mean?
Because you know how, because the live vaccines are MMR, varicella, and influenza, right?
Yes.
So that's how it is on the test, or are you gonna, or is it like what activated?
Well, that's what you gotta read.
Well, no, but. No, because I think I got the question also, but it just said all 3, so I just wanted to make sure you gave.
So whether 1 or all 3 or 2, you just gotta pick. So if it's asking what they should not be around, just look at your options and what applies. What doesn't apply doesn't apply.
Mr. Armando, so that list there is pregnant people should not be around with people with these diseases.
Yes, and if they have a vaccination, they should not receive that either. MMR, varicella, and influenza that's live, it's always the 3 that they should not. And you'll know it's not live when it says it's not. You'll say it's attenuated or inactivated. Yes? Alright, what else? That's it. So it'll be that, lupus. I don't think gout is on tomorrow's quiz, but RA will. And then gout will just be on the exam. Yes? Alright, let's get started. Page 619. Alright, gout, page 619. Says gout or gouty arthritis is the most common inflammatory arthritis and has a prevalence rate of greater than 3%. Gout is a systemic disease caused by a disruption in purine metabolism, in which uric acid crystals are deposited in the joints and body tissues. Gout is classified as either primary or secondary. Primary gout, most common, has 3 stages: asymptomatic, hyperuricemia, and acute gouty arthritis. Uric acid production is greater than the excretion of it by the kidneys. This can have a genetic component. Now, secondary gout is caused by another disease or condition like chronic kidney failure or excessive diuretic use. Treatment is based on treating the underlying condition. So essentially, right, you have your joints, right? And then the other bones are like this, right? And then you have this space in between the joint. Now, usually here, there's like a synovial membrane that like covers the joints, right? So that they don't rub against each other. Right? So like you have like a little membrane, then like a little membrane. And then you can either have like cartilage that attaches it, things of that nature. But then, in this case, that uric acid begins to build up. Yes? And as it builds up, this starts to become inflamed. And then it swells up and so on and so forth, and then that's when you have the joint becoming swollen. Now, the key here then is that it's primary, we avoid the purine, and if it's secondary, you try to treat the underlying cause. So risk factors: BMI greater than 30. Heredity, trauma, alcohol, starvation, dieting. Diuretic use, some chemotherapy, but also chronic kidney failure and disease. Yes.
What's the starvation diet? What is that count as like fasting, or is that like actually like when they don't eat, is it like under? Because I know there's like fasting, like eat every 6 hours or like 12.
No, starvation would imply you're probably going days without eating. Fasting, I don't know what in today's world or just in general fasting would be defined as. Like, what's the minimum?
Like for like 12 hours.
What's the minimum amount? Because technically, the way we should eat, or like a good recommendation is, right? Like, think about it. You fast overnight. I think like a lot of people, and something I misunderstood was you have to be awake while this happens. But assuming you eat dinner at 5 to 6 p.m. and go to sleep at 9 or 10, like a normal human, and you wake up at 6 to 7, right? You haven't ate in about 12 to 14 hours. So this allows for your GI to like rest and allow everything to just move on through. But that doesn't really happen. Like I think I mentioned this before, like I have a terrible habit of eating at night. Like I always eat at night, like right before bed. Right? And everybody's different. Some people literally can't sleep if they ate less than 3 hours ago. And they have to be at least 3 to 4 hours that they've ate. And then there's people like me that I can't really sleep unless I just ate. So obviously this is also just habit forming. So when you say fasting, if you're fasting, like I said, 12 to 14 hours, I think that's pretty normal, whether it's awake or asleep in between. But then I think starvation is when people, you're going more than a whole day, 24 hours without eating. Like you woke up today, you don't eat anything today until tomorrow. There's a whole day that you haven't ingested anything. Like, you know, you're gonna begin starving soon. So I think when you get to the point that you're triggering other mechanisms to supply your body, I think that is when you consider it starvation. Okay? Because your body will eventually lean to start burning fat as you don't eat. Okay? So, we went over risk factors. Expected findings. It's pretty straightforward. Expected findings include severe joint pain. As we said, it accumulates in the joint. Now, specifically, it says, or especially in the metatarsal phalangeal joint of the great toe, which means your big toe on your foot, that distal joint. It's very painful when touched or moved. Redness, swelling, warm. Right, now that's arthritis in general, that second point right here. And the third, appearance of tophi or tophi. These are deposits of sodium urate crystals under the skin. Usually happens with chronic gout. And have you guys seen toffee before?
Yeah.
Toffee. While you have your computer open, look up toffee. You can see how nasty it looks. Don't spell toffee, spell it like this. Toffee. T-O-P-H-I. So you can see what toffee looks like, tophi. Now, usually the uric acid deposits into the joint, right? But as this continues to progress and you have a lot of uric acid, it'll begin to accumulate small deposits under the skin, not on the joint.
It happens in the ear.
And yeah, it commonly happens like on the ear, like where there's cartilage, the nose.
So like soft.
Yeah, it starts to start coming in the soft bone, like in the cartilage. Yeah. It looks like you got like a little peanut under the skin. Just pick at them. Okay? So, the expected findings are not hard to know at all. Okay? Labs. ESR elevated. What does ESR indicate? ESR is elevated, and yes, this indicates inflammation. Blood uric acid. Well, that's obvious. That's what's causing it. You have too much uric acid in your blood. And then you also have a lot of urinary acid since you're trying to pee it out. Uric acid. These are both elevated. Remember that uric acid is the cause. This is what's accumulating. These crystals, these uric acid crystals. Now, the reason why you have a lot of uric acid is because you have a problem with your purine metabolism. The way that you digest or process your purine is not well, and so you end up with a lot of uric acid. Does that make sense? How do you diagnose this then? Huh?
Aspiration of fluid for analysis of uric acid.
Aspiration of synovial fluid. Okay, that means they're gonna go into the joint. I said that you have synovial membranes, you have this area between the joint. With the needle, they're gonna go ahead and pull some of that fluid. And what are they gonna see? Uric acid. So you know it's not some other form of arthritis, but yeah, because you have a lot of uric acid. With aspiration, they'll see it, they examine it, like what's in the fluid.
Oh, okay.
Apart. Alright, so what do we do? Monitor the following: pain, redness, swelling of the joint, and blood uric acid levels. Pretty straightforward. So pain, for acute gout, we're gonna use an anti-gout agent, colchicine, which is used to decrease pain and inflammation. Yes. Use cautiously if client to have,
Kidney failure.
so make sure you look over impaired kidney function. How do we know, or how would that pop up possibly in your test? What will they have? You check their BU and creatinine, that it's not increased. NSAIDs. Indomethacin, ibuprofen are used. Now NSAIDs is pretty straightforward. Why, right? Non-steroidal, anti-inflammatory drugs. Like they're literally gonna reduce that inflammatory process. So again, with NSAIDs though, they don't get metabolized in the liver really, they get excreted and help get processed by the kidneys. So you again are increasing problems to kidney function. Yes. And then just in general, NSAIDs, if you notice, for a lot of these autoimmune diseases are part of, again, your own immune system is what's the problem. So you're reducing the inflammatory process. So NSAIDs are common, and we saw it in SLE, we're seeing it in gout, we're gonna see it in rheumatoid arthritis. We're decreasing this inflammatory process. But then goes, again, you gotta think on beyond it. We can't just put like our shutters on for like, oh, well, what's the only thing about this disease? If you are taking NSAIDs, there's things to know. So you check kidneys function. What else? You watch out for bleeding. More specifically where? In the GI. So no, it says even in there, do not take on an empty stomach. How do you know they're bleeding in their GI? Coffee grounds and mucus, like sorry stools. No history of mine. Sarcastic. We could add it in there, but it's so uncommon to actually see a question. I feel like the GI bleed and how to take it is a more common. MI is a contraindication, specifically also for celecoxib. But I feel like it's focused mainly, the two that I always see is for sure the GI bleed or a history of peptic ulcer. ulcers, because they already have a bleeding tendency. And then, what else is to keep the inflammation down? Steroids, prednisone, and just like Ken said, you gotta know the specifics of it. Who should be wary of this? Diabetics, since it raises your blood glucose. Do not stop suddenly. As right, so they have to taper down. Those are the two most common things asked, but then there's also osteoporosis. Watch out that they're watch out for signs of infection, fluid retention, and acute weight gain. Yes? Alright. For chronic gout, you will add allopurinol. Remember, and a common question is, for acute gout, we use colchicine. And for chronic gout, for like maintenance, you use allopurinol. Use it like as a maintenance medication, like a prevention, you need to treat. Well, allopurinol is for acute. Okay, take after meals, full glass of water. Yes.
Where it says promote excretion of uric acid, is it promoting it to the kidney still, or is it like trying to get it somewhere else too?
No, it would probably still excrete it. Through urine. Okay. Do not use aspirin, because it decreases its effectiveness. Yes? All right. Last point. Patient education. Pretty straightforward. Now, one will focus around their diet as the primary thing. They should not eat shellfish or organ meats. Then the others are part of what we've already gone over. Increased fluid intake, stay right diluted, limit alcohol, no starvation, no starvation diet or aspirin. So what are risk factors? 30, starvation diets, diuretic use, alcohol. Food. Chronic kidney disease or chronic kidney failure, and then we know how the medications work. Yes? So focus on risk factors, treatment, like what does the patient do? We talked about what they have to do, what they have to avoid in their diet. And then medications, allopurinol, colchicine, NSAIDs, corticosteroids. How do you diagnose? Aspiration synovial fluid will show uric acid. Any questions? Lunch. Breakfast is real.
Armando, just say you want to break food.
I will get you that breakfast burrito right now.
Alright,